Yeah, I want to welcome everybody, our panelists as well as the others, to this session on looking at satellite data for public communication. And I'm looking forward to a great set of presentations, panel comments, and questions. I will say that the bar was raised in terms of data, satellite data for public communication by the recent eruption. I suspect most everybody has seen the satellite pictures from the eruption near Tonga, and just in terms of being able to, the comment, "A picture is worth 1,000 words." That's truly something, and I think we've seen that in satellite data as well. I mean, the stuff on the NO2 time trends, that work I think was a real game changer, and I think there's many opportunities to go forward with that, and hopefully we can start identifying those, because I think that's something that can really come out of HAQAST is some other just great images and ways to utilize satellite data for public communication. So with that, our panelists today include Pawan Gupta, who is one of the HAQAST members and been able to work with him and interact with him for years now, from the University Space Research Association. Maria Harris from EDF, Kelly Crawford, who's now at the DC Department of Energy and the Environment, and Stephanie Christel at the Department of State. So with that, no further ado, Pawan, you're on.
Okay, great. Thank you. Thanks, Ted, and thanks, Alex, and welcome everyone. So today I'm going to talk about the integration of satellite data and model outputs in air quality monitoring and forecasting system. And I'm going to talk about two major projects. One is part of the HAQAST team, regular baseline project with the Department of State. And then the second we are doing as a Tiger Team project with US EPA and NOAA. We're trying to integrate the satellite data into monitoring and forecasting system. So I just want to, you can see there is a long list of team here, but I want to highlight some of the students and young scientists who are actually supporting this project heavily. Includes Lucas from UAH, Paul from USRA, Alkma from USRA, Kirti, again, Rachel from UAH is leading the communication, and then we have Tiang Ling and Zui from University of Alaska Fairbank, and Dimple from University of Ambry University, who are actually putting a lot of efforts in making this possible. So with that, so the first efforts, we are partnering with US EPA and NOAA to bring in satellite observation into US EPA's AirNow system, which is primary public facing website US EPA has to display air quality data. So as you can see on the right, the map currently includes EPA regulatory grade monitors. They recently displaying started low cost sensors such as purple layers. Some of the satellite layers like fire hotspots, some of the smoke contours derived from the NOAA hazard mapping system are already in the system and displaying currently in the AirNow system. But as you can see from these, there are data gaps, and there is huge demand from the public during the smoke and dust event. So, uh, and also there can be useful information which satellite can provide to identify new monitoring needs or non-attainment areas. So what we're doing is we bring this new series of satellite data, GOES-R, which NOAA is producing the product. And as you can see, the list of different organizations are involved in. So our goal out, at the end of this Tiger Team project is that to bring AirNow map from this point measurements to a more spatially filled map, which can provide their quality in areas where we don't have monitor as well. So to achieve that, we are starting with a PM2.5 product, which is developed for GOES East and GOES West. These are the two geostation satellite, which provides every 10-minute, 5-minute measurement over US. And this data product is developed at NOAA by Showa Contra and Hisense Group. They use a geographically weighted regression with using real-time air now data to calibrate their model and produce a hourly PM2.5. So the first thing we did as part of the Tiger team is to come up with an unified grid system where we can actually display the data from the two satellites to use the highest, so possibly to produce an highest resolution product which can be ingested into AirNav system. The next thing we are doing here is evaluating the data sets along with the EPA's AirNav system. As you can see, the initial data evaluation looks pretty good. As you can see on the left side scatter plot, where AirNav and GOES PM2.5 are displayed. But as you can see on the right, when you start looking different air quality categories, the product currently do pretty good job as long as the values are in lower range under the air quality of unhealthy for sensitive group. But as soon as it start growing, concentration becoming very large, and this is specifically associated with the fires events in July, we start seeing underestimation. So we are working in order to actually analyze these a little bit more and understand the biases and potentially come up with a method to correct those biases as part of our project. In addition to GOES-R, we are also working on MODIS and VIIRS specifically for Alaska due to the limited coverage from the GOES-R. And this is led by our team, Jing Ching team as University of Alaska. And this slide is a little bit busy, but what it shows is a systematic way in which we are trying to handle this PM2.5 problem in Alaska, because typically wildfires dominate PM2.5 in Alaska summer, and that is the only kind of good season where we can get sufficient satellite data in there. So initial analysis have been done to actually compare the Aeronet and MODIS data over there. They looks pretty good. We are trying to bring in some model and come up with a method to get a daily maps of PM2.5 in Alaska. The last, we have developed a data processing and visualization system on cloud platform, which allow us to see the real-time validation of the GOES-R product. And this is for internal use only until we actually develop the product and provide it to the US EPA for ingesting into the AirNav. Now let me move to that was a domestic. Let me move on to some of the efforts outside US, where we are partnering with the State Department. And as you can see on the right, US Department of State through their embassy and consulate location monitors PM2.5. But if you look globally, there are only about less than 30% of 270 embassy locations they have a monitor. So we are trying to fill some of the gaps in those regions in two ways. One is trying to provide long-term historical data sets as well as air quality forecast using the NASA data. Again, we are using a hybrid approach where we use the satellite measurements. We're also using the model simulation and the surface measurements and integrating everything into machine learning algorithms to provide a bias correct forecast on these different parts of the world. Again, we are using GIOS FP, aerosol and metrology. We are using machine learning algorithms and providing once per day 3-hour forecast for next 72 hours. Again, the system is developed in a way that it provides a real-time capability to validate the forecast and correct it. So this is an ongoing efforts. We hope that we will be able to provide the some test forecast over selected location by spring or summer of this year. And last, I would just highlight that we just completed a time series analysis for all the 70 plus locations using MERA 21-year data records. So this data sets is already is ready at hourly, daily, monthly, and yearly time scale, which can be used for many different applications. And I will just stop here. Thanks. Hello.
Awesome. Thank you so much,
Sorry,
Pawan.
I was still on mute. So thanks much, Pawan. And as I said, we'll when I was on mute, we'll have questions and discussion at the end. So let's move on to Maria Harris. And Maria, I think you're going to do your slides yourself.
Yes, I think it says that I need
Pawan, if you could stop
screen
sharing your
sharing
screen.
to stop. Yeah.
Perfect. Then we'll get there.
Is that coming through?
Yeah.
It is.
Great. Well, thank you so much for inviting us to present on the panel. This is a topic, communicating hyperlocal pollution and health impact data that's very important to EDF, and something we've been learning about, and we're excited to share some learnings, but also really excited to have further discussion about what others have found to be best practices. But one of EDF's first efforts around quantifying hyperlocal air pollution was a project to map street level air pollution in neighborhoods, including West Oakland in California, which is an area currently served by a single regulatory monitor. Starting in 2015, in partnership with Google Earth Outreach, a startup called HAQAST, and academic researchers, we collected street level data on black carbon and NOx on every street in West Downtown and East Oakland using fast response air quality sensors mounted on Google Street View cars. Another key partner in this work was the West Oakland Environmental Indicators Project, which is a resident-led environmental justice group with an extensive history of community-led research and advocacy around air pollution in West Oakland. And using data from this project, we worked with West Oakland Environmental Indicators Project, or WOEIP, and other partners to develop maps that visualize the high degree of inter-neighborhood air pollution variability in Oakland, and highlighted potential contributing sources at pollution hotspots and actions that were needed to address the pollution disparities. We followed on that study with an epidemiological analysis conducted in partnership with the Kaiser Permanente Division of Research that demonstrated that elderly residents with higher levels of nitrogen dioxide and black carbon in the immediate vicinity of their homes had elevated cardiovascular risks. And in close collaboration with West Oakland Environmental Indicators Project, we developed visualizations, including this map, to visualize the results of that epi-analysis by showing the potential elevation and risk that an elderly resident would face due to air pollution exposure across each residential parcel in the neighborhood, based on the effect estimates from the study and the street level pollution levels outside each home. And one of the key learnings from these two projects were that it really was often much more compelling to community members and other important stakeholders to speak in terms of health and health impacts to people rather than just pollution concentrations. So as I mentioned, EDF's primary goal in all our work is to really leverage research and data to drive action that improves health and reduces disparities. So our team is always focused on the question of how to enable translation of hyperlocal pollution and health data to action. And on sort of one of the key elements we know is clear and accessible communications to many audiences. So in Oakland, developing communications materials for our research has been a collaborative effort between EDF, our local community partner, West Oakland Environmental Indicators Project, and other research partners. And by visualizing highly complex data in a way that is understandable to the community, we've found that data can more easily inform and support the local advocacy agenda. So I talked a bit about the interactive online maps we developed for the initial study. In partnership with West Oakland Environmental Indicators Project, we've also done a series of educational events at local schools, back when in-person events at local schools were possible, as well as information sessions for residents, sort of Q&As with involved scientists, and a lot of different briefings and engagements with policymakers and other stakeholders. So the next phase in this work was a recent study that was conducted in collaboration with Susan Annenberg's research group and led by former doctoral student Veronica Sutherland, which quantified the health impacts of air pollution across the Bay Area, this time using air pollution concentration from satellite-based models, although we actually compared that with estimates based on the hyperlocal street-based measurements from the Google Street View study. So in collaboration with the research team, West Oakland Environmental Indicators Project, and EDF communications specialists, graphic designers, and social scientists, we've worked to build public communications materials to amplify the findings of this study, as we did with some of the earlier ones. And this paper really had a couple of core findings that we were aiming to communicate in communications materials. One is that the aggregate impacts from pollution are very large in the Bay Area. The study found that more than 2,500 deaths and more than 5,200 new childhood asthma cases each year were attributable to air pollution across the Bay Area, but also that there is great variability and inequity in the distribution of impacts. So in developing communications materials for these findings, we collaborated with social scientist colleagues at EDF to run experiments in online panels of volunteer participants who are paid a small amount to work through an online survey to test various aspects of the messaging. Some of the important insights from that research was that the color palette of these maps can actually really influence perception and understanding. And it's useful to be able to test multiple palettes with your questions of interest to evaluate that. The response to the maps and the messages differed quite a bit across population subgroups. So some examples are people with different racial ethnic identities, political orientations, people who are parents versus not parents, people who have asthma, all sort of connected with different aspects of this message, or were sort of activated or turned off, depending on both the way that the messages were framed and also the order actually in which information was presented. So whether you lead with a message about inequity versus total impacts, whether you speak about results or methods first. And we learned that depending on who you're trying to reach, there are different ways you may want to frame and stage the delivery of that type of information. The ultimate visualizations that we developed were designed to convey that pollution is a major driver of childhood asthma in the Bay Area, because that was an outcome that broadly connected with a lot of people we were trying to reach, but that the impacts vary dramatically across the region. So this map shows that on average, about 1 in 5 new cases of childhood asthma in the Bay Area are attributable to air pollution, in this case, nitrogen dioxide pollution, but up to 1 in 2 cases in the most polluted areas. And we collaborated with our community partner, WOEIP, and our graphic design staff to visualize a specific example of how this disparity plays out in Oakland. So the research revealed stark racial and ethnic disparities in the impacts of air pollution in the Bay Area. On average, neighborhoods with higher percentages of residents of color were burdened by double the rate of asthma from traffic-related air pollution compared with predominantly white neighborhoods. And so we collaborated with WOEIP and our graphic design team on this graphic to visualize how this disparity plays out in Oakland. So you can see in the area in the box in the left in West and downtown Oakland, where residents are predominantly people of color, we would expect 40 to 50% of new childhood asthma cases to be attributable to air pollution, while 4 miles away in the predominantly white and more affluent Oakland Hills, we'd estimate about 20%. And we've used these maps and graphics and briefings and discussions with a number of policymakers and stakeholders at multiple levels. Some of the folks we've engaged with are listed here. And importantly, stakeholders each come at this issue from different angles, and each stakeholder really wants to know what they can do about the problem. And so our communications, we always try to be tailored to the stakeholder with a focus on potential solutions, or at least ways they can engage. In local and regional engagement, we've coordinated closely with our local partner, West Oakland Environmental Indicators Project, to develop briefing materials that support their advocacy objectives and specific calls for action. And in some cases, we've developed additional tools like this ArcGIS tool to support engagement with particularly key stakeholders, in this case, the City of Oakland Planning Department. So just to wrap up, moving forward, we're planning to develop new maps of this relationship between nitrogen dioxide and pediatric asthma. And one of the things we've realized by comparing some of these land use regression estimates with Tropomi column measurements is that there's a real complexity in communicating data at this hyperlocal scale when different approaches to quantifying pollution suggest different patterns. So maybe that's something we can get into in more detail in the discussion. But we're also planning in each of these new regions to engage with local community-based organizations to tailor maps and messaging to support local advocacy objectives. Thank you.
Very good. Thanks, Maria. And indeed, hopefully we will be able to engage much further on that, as you note. So our next speaker is Kelly Crawford.
Maria, if you could stop sharing your screen, that'd be great.
Yeah, I am lost the, sorry, Skype or the Zoom toolbar somehow.
Just,
there we go.
There you go.
Yeah.
So Kelly, you're on. Hopefully, are you able to bring up your presentation?
I did it.
We see it.
Good morning, everyone. Thanks for having me. My name is Kelly Crawford. I am the Associate Director for the Air Quality Division at DC Department of Energy and Environment. And today I'm going to share just successes and challenges that we've had in communicating air quality data to the public. And then a couple of these examples include how we use satellite data to aid in our communications. I think one thing when I was thinking about this presentation, who's the public? So for us, our public is a lot of different audiences for Air Quality Division. We have our general public, which is like our communities that we serve, but we also have to use data to communicate our air quality goals to senior leadership, often to the political appointees and to our mayor's office. So we have like a lot of different opportunities to communicate our air quality goals and also our challenges. And so I'm excited to share some examples of what we've kind of been up to. So the challenge, oftentimes I'll go to my team, and this is a graphic that it's something that I asked for, and she gave me exactly what I asked for, but then it was just like, well, what do I do with this? And so we had got a question from our council about just disparities in between different communities in DC. And so we kind of did like a first pass, what can we do with the data that we had? And so essentially we compared Black carbon concentrations from our two regulatory monitors that are in different communities. One is in Ward 6, which is a primarily white community. And then the other is our only monitoring station that is in a community of color. And so the problem is if you put this in front of a deputy mayor, their eyes glaze over and they stop listening. And so we really had to do a lot of thinking about how do we communicate all of this complicated air quality data to people that are not technical folks and help them understand the implications of what we're finding. So one of the things that we did was when we were working on our Volkswagen supplement, we were looking for an opportunity to operationalize using equity as a lens for the way that we do our work. And so we have these two images here are from one is from our they're both from our health equity report that we put out in 2018. The map on the right shows the District of Columbia just broken down by race. And so the communities that are in purple are primarily Black. The communities that are in white are primarily white. I mean, the ones that are in blue are primarily white, and then the communities in red are primarily Latinx. And so we use this image alongside the other one, which is just emergency room department visits for asthma by zip code. And so what you see is we see a pattern emerging here that the communities that are the most Black tend to have higher emergency room department visits for asthma. So we use that as a guide in how we distributed funding under our Volkswagen settlement to replace vehicles that are diesel. To take this work a step further, I worked on a paper with Dr. Annenberg, and I think she presented it at this earlier or yesterday for HAQAST. But this is still, let's say, a bit messy, and I have to do a lot of explaining. And when we added the satellite data and the additional work, what we came out with is this image. And this image was at NASA Earth Image of the Day. It's really powerful. It really speaks to how important it is to have like good graphics to communicate the data. And this is very simple. And it also helped us find something that we didn't consider, which was when we were doing the work of kind of deciding where would we put our money first to reduce air pollution. We kind of we started with this graph. And so the purple areas, these are wards that are in DC, wards 5, 7, and 8. And so we did an environmental justice grant. And in the grant, we wrote in that we would focus on wards 5, ward 7, and ward 8. We then, after we finished this study, we went back and revised that grant because what we saw was that there are communities that were outside ward 5, 7, and 8 that also had significant health impacts. So we essentially rewrote the grant so that we could include communities that were not in ward 5, 7, and 8, but still had relatively high air quality impacts. So this is just an example of how we've been actually using the satellite data to drive our goals forward. On the communication side, like I said, we have a lot of projects in process just on how do we communicate with the public. And one that we're really proud of is our Clearing the Air workshop series. And this is a non-regulatory workshop series where we invite the community in to learn about the science of what we're doing, but also about our laws and practices and how we're and sorry, where we learn about, where the community can engage with the agency and learn about not only the programs and services that we offer, but breaking down the science in plain language for the community to understand. So we hold these monthly. Right now, we're doing them virtually because of COVID. But we do have funding to expand the program, to do in-person sessions, and then also when we do the in-person sessions, allow for opportunities to assist the community in participating, like offering like gift cards for participation or paying for transportation or meals or things that makes it easier for everyday folks to come and join us. This is just another example, and this one was when we talk about all of our different audiences, this was for communicating with EPA. In DC, we had a rather interesting thing happen during COVID. Our air quality was too good. And it was funny at first. Yay, we have great air quality. We've had 165 days. We've had 365 days without an exceedance. But then we realized that there was going to be serious policy implications for this really, really low air quality day, air quality ozone season. And so this is just an excerpt from our exceptional events data story, or our exceptional events demonstration, where we combined with some troponin data from Dr. Goldberg and some quantile regression analysis that my team did, just showing that that 2020 was definitely exceptional in terms of the ozone values that we saw were the result of unusual traffic congestion in that there wasn't any, and it really impacted our air pollution levels in 2020 for the entirety of the ozone season. This is a community dashboard that it's not live yet, but it'll be live in the near future. And so we had a particular community, an environmental justice community that's very vocal and very active. And we had some past challenges with communications with this community in particular. And I remember going to one of the community meetings, and it was, you know, the very classic, the air quality monitoring people throw up their annual data, and they show the big red line of where the NAAQS is, and look how low below the line we are. There's not a problem here. And the problem was it invalidates the community's lived experiences, because they really don't care what your little red line does. Every time they look out the window, they see dust blowing off construction sites. They see diesel trucks passing by their neighborhoods, and they see, you know, fine particulate like sand and stuff all over their playgrounds where their children play. And so what we did for this community, and we plan on expanding it to other communities, is we took our monitoring data, everything that we have, and we kind of developed a dashboard with not only just the data, and we also like took off the red line. Someone said earlier about how the colors matter. So on the bottom right, you see we took off the red line and we showed the monitor in their community as it compares to the other monitors that are in the city. And so that they can really see, here you see that your monitor is tracking with the rest of the monitors in the city. And regardless of, you know, how far below the NAAQS we are, you can actually see what's going on in your community. And then we went further than that and provided some explanations for things when we saw anomalies. So for example, during this week, there was some light wildfire smoke present. And so we break that down in a way that it's really easy for the community to understand, and it's very accessible. And we hope to be able to expand this type of dashboard to more communities. So what do we have like on the horizon? So one thing that we're really excited about is getting more data. So looking at opportunities to incorporate satellite data into our dashboards and other products that we're producing, like our air quality trends report that we put out. Also, we're looking at hyperlocal monitoring efforts. For example, that's an image of a tech demonstration for a block by block air quality monitoring in one of our communities, and that's the Buzzard Point community of DC. We had a tech demo for from a company on. Also, doing better about community science, and one concept that we're looking at is this concept of air griots, and that really comes out of how do we capture as a data point the lived experiences of our residents and of our community, and then correlate that with the data that we're seeing in a way that's accessible to the general public. And so air griots is just an opportunity for us to engage with the community to actually tell their stories and allow them to tell their stories. And then we're working on ways and methods to put that in a dashboard or a format where you could go to, you could click on the community, and then not only could you see the data, you can also see the history of the community there and what they've experienced and the change they've seen over time. We're also really excited with all of the Justice 40 initiatives and the emphasis on not only racial equity, but environmental justice in this administration, that we're seeing new frameworks emerge, especially cumulative impacts and environmental justice frameworks for how we regulate air quality and how we interact with not only the general public in terms of incorporating the communities through meaningful engagement into our permitting processes, and also how do we put our priorities in order based on what the community needs. That's all I have. Thank you.
Kelly, wonderful and truly wonderful graphics. You can see why how they make such a big impact. So with that, our last panelist is Stephanie Christel from the Department of State. So Stephanie, you're up.
Thank you so much, Ted. And Alex, if you wouldn't mind, perfect. I had some technical difficulties this morning, so I'm coming to you from my phone. Wonderful. Well, thank you all so much for having me. Again, my name is Stephanie Christel. I am with the Greening Diplomacy Initiative in the Office of Management Strategy and Solutions at the Department of State. And we manage the department's air quality monitoring program, our virtual air quality fellows program, as well as our Zephyr mobile application, mobile air quality application. Alex, if you wouldn't mind going to the next slide. First, I want to give you a little bit of history and background and kind of why the Department of State is interested in air quality data in particular. And some of you may know this story and some of you may not, but the Department of State currently has or will have this year close to 80 reference grade air quality monitors at our embassies and consulates around the world. And initially, this program was started back in 2008 at our embassy in Beijing. And this was really in response to poor air quality leading up to the 2008 Summer Olympics, and wanting to really make sure that particularly US citizens had the information that they needed to protect themselves against or to mitigate their exposure to that poor air quality. And so this program started out with one monitor in Beijing, grew out to our entirety of Mission China, then jumped over a little west to our mission in India, where it grew there. And in 2015, the department established an air pollution working group, which comprised my office, our Bureau of Medical Services, our Bureau of Overseas Buildings Operations, and the Bureau of Oceans and International Environmental and Scientific Affairs as the core members, where we coordinate on both the management and the policy aspects of working on air pollution. And really the impetus of this program and the development of a centralized air quality monitoring contract was to ensure that our personnel overseas, their families that travel with them, as well as US citizens, have access to reliable, transparent, and real-time air quality data so that they can make sure that they are able to mitigate their exposure to air pollution as much as possible. And so we worked very closely and continue to with the EPA on ensuring that we are leveraging their 40, 50 plus years worth of experience and data in integrating these into our programs. And really the force behind this is that about 80% of our posts overseas, we have about 270 embassy and consulate locations overseas that do not have access to real-time air quality data, and are also estimated to be above the US EPA's annual air quality standards. So it's really important for them to have this data because we want to mitigate that risk as much as humanly possible. And so, as I mentioned, we will have this in about 80 locations, these reference grade monitors at about 80 locations. All of these locations are reporting to Air Now through our partnership with the EPA, and therefore using the US AQI air quality index, which is really important so that our US citizens have that familiarity with that data, because they're not coming at it from a scientific perspective. And we want to make sure that we can get that data out to them as efficiently, as effectively as possible. And so one of the tools that we developed recently to assist in that is a mobile application called Zephyr. And Zephyr is now available on iOS and Android. And the real crux of this is, again, using that EPA AQI, the data coming through Air Now. We've integrated this into a mobile app that enables real-time notifications for a user's particular location, so they can be notified whenever the air quality index changes, either increases or decreases, so that they know kind of what adjustments they need to make to mitigate their exposure as much as possible. And so this is really kind of the first step, and I'll talk about it a little bit more here in a few minutes, but this is really the first step to making sure that they have that real-time data a little bit more accessible to them. And then all of our locations overseas are the folks that are working on air quality issues tend to be generalists. They have a lot of experience in a multitude of areas, but don't typically go very deep into one area. And so air quality, as we all know, can be a really heavy and difficult topic in some ways. And so we also established a virtual air quality fellows program that partners US-based experts with our foreign service officers overseas to help give them more background, to provide more insight into what the data means, how the equipment works, and in ensuring that they're also doing some public outreach and engagement to also explain that data, whether that's kind of internal to our embassy or consulate community or external to the local populations. So it's really important to be able to, for them to be able to access these experts in this as well. And then, of course, our NASA partnership. We're, of course, very excited about HAQAST, and I'll get into our work with them here in a few minutes. But one other aspect of is we're also partnering with them on the Maya program, and the Maya launch will be supporting by having a few ground-based locations of equipment here to help validate some of that satellite data. So very excited about that. Alex, if you wouldn't mind moving on to the next, I'll give you a little bit more background on our HAQAST partnership and kind of why we thought it was really important to make sure that we're starting to integrate some of this satellite data, because satellite data is really helpful in kind of closing up some of these gaps that we see all over the world. And so really the impetus for our partnership with HAQAST and with Dr. Gupta was this lack of data quality, transparency, and data openness, particularly around satellite data. And there was no public friendly open product for a global application of satellite data. And so that was really the crux of our partnership, and being able to leverage this data for forecasting. So in particular, our personnel can make these important decisions about their health and safety, excuse me, was really important to how we were leveraging the satellite data, and gave us, we're hoping will give us a lot of insight into how the trends work across time. And so, as Pawan mentioned earlier, we're going to be getting 72-hour data with the combination of their satellite data and our on-the-ground calculations. They recently did a calculation of a new historical data set, that 21-year time series that was created using model outputs, ground data, and satellite data sets and integrated with the machine learning algorithm to produce these consistent data records. And you can see here on the screen, this is a figure from our consulate in Almaty, Kazakhstan, and the time series data over various months of the year over the last 20 years. So it really, you can see it really gives us insight that December, January, and February in these locations, in this location, Almaty, are particularly bad. And we don't notice here a decrease over the last few years. In fact, it stays relatively steady at several times of the year. But in other locations, we can see either a steady increase or a steady decrease. And so this will give us some kind of insight into the last 20 or so years for our personnel to review, and also to share with local and host governments. This is an important part. While it's not the primary part, it is a very important part of our air quality data, is to work with host and local governments to try and help them make improvements to their air quality, because that helps everyone. So one aspect I'll highlight for you is that we, over the last summer, we did some field outreach and engagement to our overseas locations. And this in just trying to get a sense how familiar they were with available satellite-based data. The answer is not very. And the primary reason for that, like I said, is that there are a lot of generalists, and satellite data can be very daunting to them. And so this partnership will help make it a lot more accessible and clear. And Pawan is working on a really great dashboard to integrate here over the next few months and years into our Zeph Air and other platforms to make sure that they have this data. We have really two sets of officers that work on this data. They include our management officers or facilities managers, as well as our environment science technology and that use this. But like I said, they can often be focused on kind of making sure the building runs well. You have air conditioning, you have heating, and others are focused on at least 4 different topics in that area. So air quality is just one of those. And so this will help them, in particular, the forecasting will help them send out notifications, work with host governments and the general public to make sure that that data is readily accessible. And this really filters into these tools to assist our decision making. And as I mentioned earlier, our integration with Zephyr. And as I hinted to, we do have a few challenges related to using satellite data, and that is primarily that we are working with people who have this similar knowledge as the public on satellite data. We might have a little bit more, but this is really something that continues to be a struggle, although we had a wonderful Jefferson Science Fellow a few years ago, John Karakis, who continues to work with us to make this kind of data more accessible to our personnel. And a few successes that we've had as well, one in particular.
Stephanie, we're running a little low on time. If you could wrap up, that'd be great.
Yeah, absolutely. This is my last point. And our successes are that we have been able to leverage this satellite data to move into really showing people, being able to demonstrate what especially major, as we were talking about earlier, the major events are, like in Tonga. And so a few years ago, like a year and a half ago, we were able to use this to show Tashkent actually kind of a big cloud moving over them. And it was really able to help them in their outreach and communications with personnel as well as host governments. So I'll wrap up there, and thank you so much.
Thank you all. I'd like to thank all of our panelists. Wonderful set of presentations. And we already have a question that's come in, and this is a question for all the panelists. Does your analysis, and for others, just you can put your questions either in the question and answer or in the chat box, and then I will bring them up. So for the panelists, does your analysis typically start with a stakeholder ask, or does it start with an independent research project that is then tailored for stakeholders? Do you have an opinion on which method has worked best? So that's from Caitlin Odell. So who wants to start with that?
I can start. I'd say that it really depends on the project. So we do get a lot of requests from the community for information, and that often leads to us developing either some research or developing graphics in response to their request. But also we find that sometimes communities don't know what to ask for. And so if we come up with something that we think that they might need, we can go to the community and say, how about this? Would this work for you? And so it goes both ways. I think that, and it also, like I said in my presentation, it really depends on the audience. So we'll get like requests from council or requests from our mayor's office that we say, oh, what you're asking for is not really what you need. And so we have to go back to the drawing table and try to figure out how to give them what they want to see, like that black carbon data that I showed them. It's what they asked for, but it's like, what are you going to do with this? This is just going to make people like roll their eyes in the back of their head and stop listening. So, but it goes both ways. So when the community asks for something, we try to work with them to give them what they ask for, but also sometimes it comes from researchers that have an idea and they want to do something, and we try to help them find appropriate uses for it within the community and make those connections. But as long as the community or the stakeholder, whoever the person receiving the communication, it's just important that there's a real understanding of what they're actually trying to find out, what they're trying to see, and what they're going to use it for. So that helps develop the best products.
So I can add a little bit more on that. Thanks, Kelly. I think I agree with most of the thing. A couple of things I want to add is that often when we go to stakeholder or something is ready to be deployed in operational environment or to be delivered to stakeholder, that topic has to be researched earlier. So may not be in a specific project we're starting from the zero, but a lot of these things are already researched in other topics or other people or during the other projects. And once that is matured enough and we are, as a scientist, we are confident that this method, this data works, then sometimes you go to the stakeholder and try to work with them to understand their problem and how your data products fits to address their needs. So that is one way. Another thing is sometimes stakeholders come and ask for a specific requirement and not necessarily we have the solution for them. So for example, we discussed this yesterday that a lot of people are concerned about indoor air quality. And when we talk about satellite data, definitely we cannot look inside houses from the satellites. So there are rooms for research there in order to how we link the outdoor air quality with the indoor, but it's a very researchy thing. We don't really have something ready to give that kind of community. So I think it works both ways, but most of the projects does come from a lot of research and convert into operation.
Thanks, Pawan. Others?
Yeah, I think I really appreciate all the points that have been made so far. And I think our experience has been that one of the really key elements of this is having long-term collaborative relationships with the communities or other stakeholders who you are hoping to reach, and having information flow in both directions. So it's not that, we show up with research that we've already completed and say, how can you use this, so much as we are talking about what their objectives are. It doesn't mean we necessarily are, changing every research objective to answer specific questions, but that we're looking for overlap between things that these stakeholders are interested in, need to know, and science that we know might have the capability to speak to that. And I think it's if there's enough of those conversations and engagement going on over time, you can gradually sort of refine the research aims to be more responsive to what people need, as well as learning things that you might not have understood about what the needs are, which I think, yeah, it's a challenge because it's very resource intensive, staff intensive to have that type of engagement, and it's something that EDF is very much still learning and still evolving to better support.
And I will just add on to that a little bit too, that it takes a lot of base education as well, in terms of getting people up to speed on kind of what can work and what can't work, especially when you're dealing with data, as Pawan mentioned. We can't see indoors, even though that's something people want.
Yeah. Okay, thanks. Moving on, the next question comes from Rachel Gurney, and hers is, it's actually, I was wondering this as well. I'm an engineer, so my aesthetics may not be our challenge, let's put it that way. So her question is, what resources do you use to inform your communication choices? For example, language, colors, approaches, etc. And a number of you had some tremendous graphics. And so the question is that I think really communicate well. So what approaches have you used to come up with those? Anyone?
Well, I'll say mine is really easy. Our Office of Communications dictates our color palette. We have it DOEE green, and we have like the little code for it, and we have to use it. So I don't have. So if you see a PowerPoint from me or anyone else in my agency, they're all going to look the same. And then for language, so we do have languages that we are required to translate into. They're the most widely spoken languages in DC. So that includes English, Spanish, Mandarin, and Amharic. So we translate most of our materials into those 4 languages. But we go further on some materials we do for specific communities. So for example, we regulate dry cleaners in the district, and we found that the majority of dry cleaners were Korean speaking. And so all of our dry cleaning materials, we went the additional step to translating them into Korean. So when we find that we have populations that have specific language barriers, we go a step further and ensure that we make materials available in native languages.
No, I will say, Kelly, that actually, and this is a comment that was made in the Q&A as well, is that in terms of some of the graphics, your 2-axis color bars, that was very effective. And, you know, it's, so I think the question might approach, how do you, you know, how much effort and how do you go about coming up with some of those other great graphics to really communicate your message?
I leave it to the communications experts.
Okay. You know, and I think that's, again, as an engineer, some of us, I don't have really the, you know, what is going to look best unless I've seen it before.
Yeah, we're lucky to have a really great comms teams that does a lot of that for us and ensures that whatever we're putting out not only is aesthetically pleasing, but that it's easily understood by the general public. And they do a lot of research, and they focus on what they're good at, and we focus on what we're good at, and together we make a really great team.
Others, because a number of you, I mean, I think all of you, the graphics really told the story. So what other lessons do we have there?
So I'll just add one thing here, that as a scientist, I think we always struggle in terms of communicating our data to the public. I think we can communicate very well within the scientific community, because there is always this struggle, how much detail you want to make it clear from your graphics versus making the take-home message point out very loud. So I think that tension there is always there. Okay, what? So I think it depends on your audience, that what kind of graphics will be more effective. If I had to display a lot of data where I need to show the details, then probably I will use the color scale, which is our graphics system, which is more able to provide more details, whereas the other way around is that with the smaller number of colors and making sure that you are hitting the main points.
Thank you. Actually, let's move on. The next question, and this is to Kelly, talking that air pollution events in the eastern US are often due to high pressure events when it is hot and stagnant. Do you fold some of that information into your considerations when you provide warnings for DC? Some of the adverse health impacts could be a combination of both heat and bad air quality.
So DC is in a regional organization. So we have MWAC, which is our Metropolitan Washington Council of Governments. And we have a forecasting group that includes Maryland, DC, and Virginia. And so the forecasters during ozone season do 3 days ahead forecasting for predicted ozone events. That's the only pollutant of concern in DC. So I'll say the benefit of that, it's a regional effort. And so it doesn't fall only on this one agency to do that work. It's in combination with Maryland Department of the Environment and Virginia DEQ. So that's the body that does our forecasting. Right now, the air quality alerts only come out for forecasted code red days. We are working on ways to better improve our public communication about unforecasted events. So for example, there was like a wildfire and uncontrolled burn in Virginia that caused us to have air pollution exceedances in the district that right now what we use is our emergency management system to send out tweets and alerts through people who are registered for that when we have like local events. And a really good example of one an event that we know is going to happen but can't forecast is the 4th of July. So 4th of July, every single year since 2019, we've gone Super Saiyan for particulate matter in the middle of the night. for hours and hours and hours. In 2020, I believe the exceedance lasted from like 9 p.m. until 6 o'clock the next day. So we don't have, let's say, a system in place to automate warnings, but we also were lucky that the year that we had that event, the fireworks were not attended because of COVID. And so we were, it was just like, dear, what would we have done if we had had those levels and like, 100,000 people in the National Mall? We would have definitely seen health impacts there. But luckily that year, most people were in their homes.
Thanks. Any other comments or on that? I want to get to actually one of the last questions that's come in on the Q&A, but I think it's really important. And that is, what would be your biggest pain points when using NASA data and using it for public communication? Anyone want to address that?
I'm happy to,
sorry,
go ahead.
Yeah,
No.
Go ahead, Stephanie.
No, I was just going to say I think one of the biggest pain points, and this is not necessarily about the NASA data in and of itself, but I think it's the feeling that people are intimidated by satellite data. And I do think NASA has created a few tools to help make it a little bit more accessible. But I think when people hear satellite data, there's an immediate kind of fear. And so I think it takes a lot more education to get over that hump, more so than other kind of what seems like kind of more accessible data.
So that's mainly, you would say, on the perception side that they fear it almost.
Yes. At least that's been my experience.
Yeah. Maria, you were about to say something, I think.
Yeah, I was going to speak to this, I think, issue that I mentioned at the conclusion of my talk, which was the complexity and challenge in conveying uncertainty in this type of data when you're speaking to the general public. And I think particularly satellite data, which, there's lots of scientific efforts focused on better quantifying uncertainty. But we still have a situation where we get different patterns, different answers sometimes for what a pollution surface looks like in a given area, depending on which method we use. That is something we want to make sure we're reflecting when we present a surface based on one method. We want the decision makers who we're speaking to understand the potential uncertainties, but also not to have that message about uncertainty undercut what the clearest message is, which is that we know these pollution exposures are having health impacts, and it's important to act with urgency. So I think we've thought about that in terms of, for example, the width of color bands that we use in these maps, and not conveying too much precision in a situation where we don't feel confident about that precision. But it's an ongoing issue that I think is really ripe for further work and further thought.
All right. The next question comes from Ranil Dhamapala is, what is a good way forward to provide people with the kind of hyperlocal data they need that accounts for all the pollutants that are important in their communities? We're mostly focusing on PM 2.5 worldwide, with some emphasis on NO2 and ozone, thanks to satellite data. When PM10, SO2, black carbon, or other air toxics are important, how do we fold those in? Some thoughts. Anyone have some thoughts on doing that?
So I can talk about the satellite perspective. I think one of the things, and this relates back to the last question about the one of the issue we have currently from the satellite data is air quality community or the health community or public need the data which they understand, like PM2.5 mass concentration or surface level NO2 concentration or black carbon or PM10. And as we have seen in many presentations, satellite community is still in making sure that those products are available. Means right now we are still working with aerosol optical depth, which not necessarily the same as PM2.5 or PM10, or the column NO2, which is a little bit different than what is at the surface. So I think the biggest challenge I would say is making sure that satellite products speak the language of the air quality community need. And I think until that happens, it will be very hard to actually use the satellite data, and not only use, but to fold into this multi-pollutant air quality or health index, which can be more useful to the public and other practitioners.
I'll just add to that. It really depends on the audience and what they're going to use it for. So if you're trying to develop a product to help people make good decisions about when they're going to go outside, especially if they have like asthma or something, they might not need to see like the individual data points. You don't want to ask the community to be atmospheric scientists and public health specialists. What you want to do, and that's why, you know, AQI is a really great tool for communicating. It only includes the criteria pollutants, but that's why like some of the dashboards that states and locals are doing, like combining EJ screen data with monitoring data to, you know, boil it down to a code. Like this is a good time. I think it's California has a tool where it says like, these are the times of the day when the air quality will be the worst. So you might not want to take your job then. So sometimes it's not so much what data you communicate to the public, but what is the message? And that's what really matters. And like I said, depending on the audience, the message should be different.
Thank you. Yeah, I think that's very much the case. So the next question is for Maria. Could you elaborate on which frames, e.g. leading with equity, et cetera, that you talked about in your presentation, were the most effective for specific audiences in your studies? And I'll add to that, and why? I mean, what do you think are the real drivers on deciding how to lead?
Yeah, well, I think the answer here again is it depends on the audience. And for me, one of the most important insights from the testing that we did is that people have all different responses to this information, depending on lots of different aspects, you know, demographics, political leanings, and the intersection of those. And so it's complicated to come up with a solution that works for everybody. So I think one of the things our communication specialists always emphasize for us is you need to think about a specific audience that you're trying to reach with every message and what will motivate that audience. When we speak, you know, to the broad public on, you know, our website, we're always trying to measure sort of or balance conveying what we need to the specific audience we're trying to reach, and also, you know, not alienating other audiences perhaps. So the you know, one specific example is that we found equity-based messages to connect more with people who leaned politically liberal, who were already sort of self-identified as environmentalists, were more likely to be activated by the messaging. It was sometimes more effective with conservatives to lead with methods or results. And in other studies, our social scientists have actually seen there's sometimes a benefit in leading with complicated methods when you're speaking to a potentially hostile or opposed audience, because it helps sort of challenge their assumptions about how much they already know about a topic and think about the complexities of the science involved, and then maybe helps sort of open people's mind to alternative conclusions. But all of these things, are quite complicated, and there's definitely no one size fits all answer.
Yeah. Thanks. And we just have a couple minutes left. I had one question, and this is very much comes from the HAQAST asking sort of our stakeholders, is if there's one thing that HAQAST could do to essentially make it easier and more effective with the work we're doing with developing satellite data for public communication, any thoughts on what it would be? Just what could HAQAST people be working on in terms of supporting your type of efforts to utilize satellite data for public communication? And I think we had one is to make it less, to make it more friendly, to make it so there isn't this fear. Are there any other thoughts? Not a big response there. If you have some, I think if there's things HAQAST can do to support this type of work, great. And so the last question then, again from Jennifer Way, what is the most health concern from air quality perspective to your community? And concern to health facilities. So are there thoughts on that one? So Kelly would like to answer this question live.
I do. I actually have a really good graphic from that study. I'll bring it up. But
great.
So for us, for the one that we're trying to address right now is asthma in communities that have a disproportionate or disparate burden of air pollution. And I have a slide that I took out of my presentation, but I can share it now real quick since there was a question. Just 1 second to share my screen. I'm doing all the Zoom things. So this is from the study that I talked about earlier, but this shows all of the it shows all of the health impacts, and then this is all of them by the 51 statistical neighborhoods. So we can actually not say like in blanket what is the most important health impact. We can go like community by community and say what is the most important health impact in that community. So that's one of the things that was really useful about the work with Dr. Anford. So you can see that, for example, in this community, you see there's higher concentrations for lung cancer in the southeastern neighborhoods of DC, but you can see that perhaps in Northeast, there's a less incidence of lung cancer, but higher incidence of COPD. So we have the information to be very, very specific in which communities are struggling with what types of impacts.